Hello, my name is Lisa Oswald. Thank you for listening to my presentation entitled Adolescent Violence Causes and Interventions. This is a very important topic, obviously. However, it's also important to me because I work with students with special needs, and a lot of them have either participated in violent behaviors or were victims of violence. Violence perpetuated by adolescents is a major concern all over the world. The term violence means aggressive behavior of an individual with the goal of severely injuring or killing someone. A greater amount of violence is committed by students, or children I should say, between 15 and 24 years of age, more than any other age range. As a result of violent behavior, homicide is the leading cause of death amongst adolescents each year, which surpasses deaths from cancer, heart disease, flu and pneumonia, strokes, diabetes, and so forth. All over the world, 300 million children under the age of 5 are exposed to violence. There is therefore an urgent need for a comprehensive intervention program to be implemented with young children in order to decrease future violent adolescent behavior. There are several causes associated with adolescent behavior of violence. Neurobiological factors are one cause that contributes to the youth violence. Cognitive deficits, complications during a mother's pregnancy, genetic factors, and neuropsychology are some neurobiological contributors. Prenatal care affects neurobiological factors that contribute to adolescent violence as well. A pregnant mother can be exposed to maladaptive environments, which could have a detrimental effect on an unborn child. If a pregnant mother has extreme chronic stress during pregnancy, the mother's brain will produce high amounts of cortisol, which is a stress hormone, and that is shared with the unborn child. And as the unborn child receives the higher dosages of cortisol, it will become unable to control their emotions, have negative thoughts, and engage in maladaptive behavior throughout their lives. Maternal drug use is also a concern because it increases aggression and decreases appropriate social behavior for at-risk teenagers. Not only are there neurobiological development issues during pregnancy, but there are also neurobiological development concerns due to adverse childhood experiences. Situations such as family violence, abuse, whether it's sexual or physical, or neglect, and traumatic events such as children being taken away from their parents or families can also affect cortisol levels that impact the child's response to stress. These adverse childhood experiences negatively impact brain development in children because when a child experiences intense trauma during an early age, the brain's ability to accurately remember traumatic events and to regulate emotion decreases. Future outcomes for these children who grow up in chronically stressful environments such as low socioeconomical disadvantages and chaotic households tend to show challenges with attention control, impulsivity, and have poor inhibition. Parental influence is another cause for youth violence. Parents who are harsh or rejecting or who engage in violent behaviors among themselves or are abusive or neglectful towards their children can contribute to the risk of increased violence behaviors in children. Parents who also create a chaotic home life, engaging in unclear discipline patterns, and who lack the awareness when their child is in need of psychological services also increase the chances of violence in adolescence. Parenting styles contribute to the child's attachment, and the better the child's attachment to their parents, the more comfortable they will be, the more secure they'll be, the more capable they'll be of regulating their own emotions. Some parents, however, have their own psychopathology, and the child's characteristics along with that psychopathology can be affected. These factors affect child development. Again, secure attachment ensures future ability to maintain positive social behaviors during childhood and adolescence and even later, whereas insecure attachment could lead to mental illness and behaviors that result in violence. Impulsive behavior may also be a contributing factor for adolescent violence. Kaufman and his colleagues noted that violent behavior declines after adolescent years for most people. They initiated a longitudinal study in order to determine whether impulse control training or attainment of social roles was the main reason for the decline in adolescent violent behaviors. The study followed 1,170 males and 184 females who were ages 15 to 24, and they used a Weinberg Adjustment Inventory Impulse Control Scale as well as self-reporting anecdotes at intervals of every 6 months for 3 years. The results were that impulse control as the person aged was the main reason for less violent behavior over those years. Studies show that violent media can also have a significant impact on teenagers who become violent. Repeated exposure to violent media at a young age has led to aggressive and violent behavior when taken into conjunction with the child's intelligence, poverty level, and parenting patterns. Parents are able to control violent content on television and media by using filtering devices to restrict violent content. Another concern also would be that there are guns in a lot of children's homes, and gun ownership could also contribute to adolescent violence. Bushman and his colleagues suggested that large amounts of gun ownership and lacking gun control laws in the United States is the main cause for adolescents being able to utilize guns. An example of that would be that American school shooters under 18 years of age attain their guns from home. Bushman and his colleagues also identified alcohol and substance abuse as being associated with the risk of youth violence. Yet another factor that can cause violent behavior in adolescents could be social status. Social status anxiety, multiple past social rejection, and peer dynamics can negatively affect the risk of child-youth violence. Logan Green and her colleagues tested the multidimensional assessment of risk and protective factors that gauge adolescent strain, coping skills, social network, and peer support to explain violent behaviors. The study participants were composed of 416 high school students from Northwest and Southwest United States, and they were all in grades 9th through 12th grade. The students had below grade levels, were at risk of dropping out of school, and also had a lot of referrals for detention due to behavior. Part of the multidimensional assessment examined peer behavior and its influence on high-risk students. An 8-item scale assessed peers who engaged in high-risk behavior such as drug alcohol use, who skip school, who fight, and who get in trouble with school or get in trouble with law. It looked at peer support in the form of classmates, best friend support, the availability of peer support, and the feelings of belonging and loneliness of these students. Findings from this study identified that strong peer relationships deter violence, which suggests that peer and school-positive relationships can serve as protective role of minimizing anxiety and aids in building positive social skills, which minimizes violent behavior. Bush and his colleagues also identified that rampage shooters tend to experience large amounts of rejection when trying to join peer groups. It could be that the peers are finding that they have lacking social skills, in which case they were not accepting of that particular student or child. So what is the answer to working with children who have behavioral violence, right? Or really adolescents with violence? Alternative schools have been developed in many school districts throughout the United States in response to students who engage in violent behavior, because these students with the violent behaviors do not get support like children who are diagnosed with special needs. The only option most of these children have is to go to an alternative school. Alternative schools are available for violent students. However, they may not be the best support for these children and adolescents. It was reported that there is not enough research on alternative schools to identify whether alternative schools are beneficial to the growth and development of violent students. Another concern is that violent adolescents are often put in the same classes as adolescents who are victims of violence, and they are creating peer groups in which victimized adolescents continue to be victimized. There have also been no comparison studies that link prevention and treatment initiatives for alternative schools. The outcomes for students who attend alternative schools do not have high future success rates either. Students with violent behaviors who matriculate at an alternative school are more susceptible to poor future outcomes, such as high school dropout, engaging in crime, difficulty in interpersonal skills, higher hospitalization, mortality rates are higher, they have job instability, and larger risks for drug and alcohol use. There has been research into intervention for early intervention programs for young children as a way of minimizing violence among adolescents. Bushman and his colleagues noted that children are able to develop self-regulation skills in early childhood. Therefore, teaching children to control their behavior and emotions can increase self-control and decrease maladaptive violent behaviors in adolescents. One meta-analytic review utilized 34 studies with randomized controlled experimental designs for changes in maladaptive behaviors. Participants in the study were aged 10 and under. The experiment measured self-control and maladaptive behaviors exhibited by those children. After participating in an intervention program and experiment, the results indicated that children were able to make small to moderate improvements in self-regulation and were able to lower their maladaptive behaviors. Bushman and his colleagues further noted that intervention that includes parents and schools which address social skills and other factors can minimize youth violence if the program begins in first grade and contributes throughout childhood into adolescence. Bushman and his colleagues contend that if parents improve their parenting skills, then children and child aggression and violence tend to be minimized. They also expressed that preschool programs that teach social school readiness and school readiness, incorporate parent involvement, can reduce criminal behaviors in children by nearly 75% for disadvantaged youth. Children who have difficulty with self-regulation benefit from having supportive adults. A qualitative and quantitative study to determine whether teachers who provide self-regulation training to students can improve self-regulation and minimize maladaptive behavior. The teacher met with the researcher every 3 weeks and for 3 months to evaluate student progress. The result of the study suggested that kindergarten teachers were successful with improving children's self-regulation when teaching those skills. Another experiment conducted by Giovanelli and her colleagues corroborates the results of Dan's study that I just mentioned. Giovanelli and her colleagues conducted a path analysis. Their quasi-experimental design utilized 677 African American children. The study consisted of 4 elements: stable environments in early intervention, parental involvement, structural curriculum, and languages and basic skills development from preschool to 3rd grade. The results indicated that children who attended early intervention programs improved their long long-term outcomes with regard to lowering arrest rates for adolescents when compared to children who did not participate in the early intervention programs. They found that parental involvement directly affects child progress as well. So it is clear that one way of combating childhood and adolescent violence is through early intervention programs. One such program that has been successful with violence prevention is called Promoting Alternative Thinking Strategies, or PATHS. Promoting Alternative Thinking Strategies is one of the most widely used social emotional school programs for preschool and elementary schools that teaches children self-control, emotional understanding, and interpersonal problem solving. The PATH program is based on 3 psychological theories: the developmental social cognitive theory, the cognitive developmental theory, and the attachment theory. The goal of PATHS is to create lessons for students that promote social emotional ability, increase academic skills, minimize behaviors as a result of emotional problems, and improve positive school environments. PATHS programs build positive teacher-student rapports, which instills pro-social values and optimizes education, creativity, and cognitive connections through use of emotional expression and learning through discovery. She and his colleagues conducted a review that examined self-regulation, emotional understanding, positive self-esteem, relationship building, and the ability to problem solve. The longitudinal study utilized 30,454 participants who were in preschool to elementary school grades to participate in the PATHS program, and then follow up on the effects of that program for 1 to 7 years. The results demonstrated that children who participate in the PATHS program at least twice a week improve social emotional skills in order to reduce maladaptive behavior, including children in low socioeconomic environments. PATHS programs incorporate role play, art, music, communication, and social stories to connect social emotional situations to real life scenarios. The outcome is the children have the less aggression and violent behaviors due to better emotional competency. So, some key takeaways. Adolescents who engage in violent behaviors have multiple reasons which could cause them to be violent, such as neurological risks, poor family interactions, lack of impulse control, violence in the media, gun ownership, and alcohol and drug abuse, as well as maladaptive social skills. Comprehensive intervention programs need to be implemented with young children in order to decrease violent adolescent behavior. The PATHS program is one example of an early intervention that utilizes developmental theories in order to create a comprehensive program that helps students gain academic, social, emotional, and interpersonal problem-solving skills for all children. PATHS provides for social emotional learning that can positively affect a child's attitude, social emotional skills, create proactive behavior, improve academic performance, and decrease emotional distress and maladaptive behavior. Having children participate in PATHS intervention programs could lead to a decline in violent behaviors in adolescents. However, the PATHS program alone may not be the sole answer to interventions that would decrease violence. A need for parent training services to improve parenting and early prenatal care that provide pregnant mothers with interventions would decrease the likelihood of violence for adolescents as well. It is also necessary to provide for adolescent intervention for at-risk teenagers who experience adverse childhood experiences. Ultimately, communities need to identify problems and risk factors and create a strategy to implement in order to impact prevention and intervention. The previous mentioned studies noted that PATHS programs and other early intervention programs can minimize violent behaviors, but other types of interventions are needed that address all factors leading to adolescent violence. By developing a comprehensive approach that includes these varied interventions, communities can effectively reduce the occurrence of violence among adolescents. Thank you so much for listening to my presentation. Here are some of the references that I used throughout my presentation. I had a very interesting experience with this. I like learning about violence, and that I think it'll help me support my students better in the future. Thank you again for listening to my presentation, and I look forward to hearing from you and your thoughts. Thank you.